Hi, I'm Dr. Emily Shaheen. I am a board-certified hand and upper extremity orthopedic surgeon with Northeast Georgia Hand. And I'm here today to talk about trigger finger. So one of the most common things that I treat in the office on a day-to-day basis is trigger finger. And a lot of patients come in and have one or have had multiple trigger fingers in the past. And they say, "Doc, why do I keep getting these trigger fingers? What's going on?" So a big part of trigger finger, and there's a lot of reasons someone can have a trigger finger, but a big part of trigger finger is an overuse injury. So when we use our fingers, the tendons that go to the tips of your fingers glide under a series of tunnels that allow for smooth and accurate positioning of the tendons to allow you for grip and extension. And so the flexor tendons that go through the fingers can get irritated with overuse. And so repetitive gripping type activities can cause the tendons to get inflamed. And as they get inflamed, they reach this critical volume of inflammation that they can no longer glide through the tunnel system. Other reasons people can have trigger fingers can stem from conditions that cause swelling, so pregnancy, diabetes, inflammatory arthritis like RA can cause swelling around the tendons or in joints, and that can ultimately lead to a mismatch in size of the tendon and its tunnel. But for whatever reason, once you get to that critical point and you can no longer either bend the finger or it catches or locks or causes pain right at the base of the joint, that's when to come in to get evaluated. And treatment options for trigger finger, typically we start like anything with the least invasive option and kind of move forward with that. And so again, that's my general take on trigger finger. But it's a super common problem. Sometimes people don't really know what it is and they feel like maybe it's arthritis or change in weather, but it's a really common and easily treated condition that we see all the time. So if you have that or some of those symptoms, come on in and my colleagues and I would be happy to see you.